Hello all, this video shows tips for a successful Rhexis. This is a hard cataract in old patient. First, inject blue with air bubble so that air bubble prevents the endothelium from staining and presses the blue over the capsule. Inject sufficient Visco into the anterior chamber and inject little Visco above the cornea to get a clarity. First, anchor the globe with your synth key. From the center of the capsule, draw a 4 mm line. After drawing the 4 mm line, fold the flap at 1/3, 2/3 of its junction. Once you raise the flap, keep it iron always with Visco. Keep moving the flap with holding posterior edge of the flap. The key to successful Rhexis is make the anterior margin of the flap always iron over the rest of the capsule. In the beginning, better to put Visco for every quadrant of completion. Keep moving the flap by holding posterior edge of the flap and simultaneously fold the anterior margin of the flap. Take a guidance from iris margin for a circular sufficient sized Rhexis. For every quadrant of completion, put Visco over the flap. Here, shearing forces of movement are used. While at the end of the Rhexis, pull the flap towards the center, applying tearing force. This is 4 to 5 mm Rhexis for size phaco. Here, this is the wrong way of doing. There is a bigger flap is raised in the beginning, which may extend, and the anterior margin of the flap is not iron, it is flying all over the Rhexis. There is a high chance of extension.